okay?
Yes.
Well, thank you for calling. Where are you calling from?
I'm calling from Dearborn, Ohio.
Dearborn, great.
Huh?
Right next door and home of right there at the Air Force Base. Very proud.
That's correct.
Go right ahead, Renee, with your question or comment.
Oh, I tell you, I have so many comments and questions. It's really hard to cycle them down. But one comment that I wanted to make is I get so concerned about actually even Congress coming up with a plan. I think that they should have some sort of a bipartisan committee, not of Congress people, but that would look into it and then recommend to Congress some things that might be done, because I think Congress is too, everybody's got their own little agenda that they want to do. But my question is this, and I'd like to see nothing done right now until, something can come together that would make better sense than what they're up to now. But I also feel frustrated, as another woman said, that they don't listen to the people, and they call it mob rule or whatever. And is there anything that a citizen can do to be heard? This is one way, but you're just hearing it. How can the common person really get through to our Congress?
Renee, thank you for your comments. I appreciate it very much. You make a very extremely important point of listening. I was in the district over our recess from Washington, D.C. It turned out to be a district work period for me, which is fine. It gave me an opportunity to get into all 8 counties of my district and to listen to people. We had a live town hall down in Washington Courthouse where we had a packed senior citizen center with folks expressing their concerns and their thoughts about healthcare reform. We've done these live town halls where we can get 14,000 or 15,000, almost 15,000 people last time that were on the phone being able to talk to me and express their concerns. The people have been coming into our offices in Springfield and Lancaster expressing their concerns. The intensity level is very high, and I hope that other members of Congress are doing what I'm doing. I hope that they're coming to watch. They went out in the district. They listen to their constituents, and they're coming back to the district, to Washington, D.C., with that trend of thought, because clearly there was an attempt to rush a health care reform bill to the House, H.R. 3200, and they were members of Congress that were leadership on the other side that was trying to force this through, Speaker Pelosi, and also the President was trying to get this through very quickly, had not listened to the American people, because if they had, they would have been hearing the same thing that I heard, and that is the concerns about a government option run plan. We're now back in Congress, and we will now continue to debate over reforming our nation's healthcare system. I think it's very important that we don't lose focus on what's important, that is controlling costs, providing the best health care for every American. But as we proceed with health care reform, it's important that Congress be able to have an open and a healthy debate on both sides of the aisle. To this point, we have not been included on these major bills like H.R. 3200. The Democrats have not included the Republicans on it. We were not included on the stimulus package. We were not included on the cap and trade bill. And I think this is such an important issue that we should put the partisanship aside and be working in a bipartisan manner, and most importantly, listening to the American public. Because I can tell you, when I was out in the district, it didn't matter if it was at the Senior Citizen Center, the live town hall meeting. It didn't matter if I was on the soccer field. I had 3 sons that are teenagers, and 2 of them are still playing soccer, talking to soccer moms. It didn't matter if I was in my healthcare advisory committee, district-wide committee. People were talking about healthcare, and they were expressing their concerns to me about a government takeover of healthcare, about this public option portion of the healthcare plan. And I heard you very loud and clear, and I hope other members heard as well. So, again, thank you for your call. I appreciate it very much. This is Congressman Steve Austria. And sitting here in my Washington, D.C. office, glad to hear from all of you in the district. Glad to be talking to you in the district while I'm here in Washington. Look forward to getting back to the district tonight. And I want to thank all of you for participating in our Teletown Hall meeting this afternoon. Just hit *3 on your phone, and it'll give you an opportunity to participate and ask a question or make a comment and talk about whatever you want to talk about. And the topic this afternoon seems to be healthcare reform. We'll go back to the phones right away, and we've got Paul on the phone. Paul, are you able to hear me okay?
Yes, I can hear you, Steve.
Where are you calling from, Paul?
Baltimore, Iowa.
From Baltimore. That's great. You got a wonderful town there. You got a good mayor who's doing a good job for you. But yeah, go right ahead, Paul.
Well, your government wants to insure 30 million more people. How are they going to get the doctor to take care of 30 million more people? They ain't going to have the doctor to take care of them. It's going to be healthcare rationing. You won't be able to see a doctor. Get 30 more people on it. And those people will be going to the doctor every time I have a cut finger.
Well, you raise a very important point, because you're exactly right. I mean, if we move towards this government public option, there's a very good chance we will have, right now we're struggling to get physicians in the medical industry, or medical field, and expanding the healthcare field. We start moving this direction, I think there will be a less for doctors to want to be in that area and specialize in those areas. And then you start bringing in millions and millions. You mentioned the figure of 30 million more folks that are going to require health care, more coverage. And how do we cover those individuals? How do we provide the quality health care that we have right now with that doctor-patient relationship with I believe, the best health care system in the world that we have right now? But, again, I want to also point out that we can be reforming the system we have right now by making it better. We can be focused on lowering costs and controlling costs. We can be focused on accessibility. We can be focused on how do we improve the quality of care for patients. And we should be focused on improving the system we have right now, not overhauling it, just completely throwing it out and starting over with a brand new system, a government-run system that's going to be run by a bunch of bureaucrats in Washington, D.C. So thank you very much for that call. I appreciate it very much. We'll go right back to the phones. We're going to talk to Deetra. Deetra, are you able to hear me okay?
Yes, sir, I am.
Thank you for calling in, Deetra. Where are you calling from?
Beaver Creek, Ohio.
Beaver Creek. Great. Go right ahead with your phone call, or your question, or whatever comment you got.
First of all, I'm part of the Beaver Creek Liberty Group, and we're very concerned with the healthcare legislation. I have a few comments and then a few questions. The first comment, the Cato Institute has several better reform plans that are currently in Congress right now. The CEO of Whole Foods has better alternatives than what's being presented right now. It's not government's job to lower the prices. It's government's job to get out of our way, and the market will take care of the prices. I would love to see equal tax treatment. I get different tax treatment from if I go and buy an insurance plan off the street versus getting it from my employer. I shouldn't have to choose what my employer chooses for me, and I sure as hell shouldn't have to be provided only what the government thinks I should have. Some other people have mentioned portability and shopping across state lines, which I completely agree with.